All right. Thank you guys so much for coming. Thank you, Dr. Gosselin, for that introduction. Again, I'm Suzanne Jaynes. I'm with the Equine Clinic at Oakencroft.
One quick adjustment.
Okay.
It would be helpful if they could see it.
Oh,
which
sorry.
I forgot to do.
So basically, Dr. Gosselin and I are going to just get you warmed up slowly. We don't want to overwhelm you with too much, deep thinking this early, and we'll get more complicated as the morning goes on. But we're going to talk about what you need to consider and get ready for breeding season. So I'm just going to run down, first start off with a little bit about risk tolerance and things you need to consider. A lot of you are, I'm sure, experienced breeders, and there's maybe some people in the room that are debating whether they want to do that. So we're going to talk about some risk associated with it, a little bit about mare selection and general health considerations, getting your mare cycling early, a little bit about breeding soundness exams, semen selection, and foal planning. And then I'm going to kick it over to Dr. Gosselin, and she's going to talk more about getting ready for foaling and from there. So the first thing we really need to talk about is your risk tolerance. And in other words, how much do you love your mare? And that's kind of an obvious thing. You love your mare if you want to breed her and continue on her legacy, but you also have to realize that there's risk associated with breeding and with foaling. And so if you know that there's no way you would risk losing your mare, then perhaps this is not the right route for you to go. And you might want to consider embryo transfer, for example, and use your mare's embryo and put it into a recipient mare. Some of the causes of death around foaling, and even if there isn't a dystocia, even if it's a normal foaling, they can have periparturient colics. You can lose your mare to post-foaling ruptured uterine arteries. They can bleed to death. They can sustain injuries to their reproductive tract, vaginal lacerations. They can sustain a uterine prolapse post-foaling, that cause death, and even fractures. So, a lot of people love their mare, but they don't consider this beforehand. So that's a major consideration. And then, you may go through all the steps of breeding your mare and all the financial commitment and the emotional commitment, and then the foal may die. You may have late-term abortion. Your foal may die during birth or shortly after. So that's something you need to consider. Do you want to take that risk? And then obviously the worst case scenario is that you lose both of them, and that would be obviously very devastating. So again, you may think about these things and say, wow, embryo transfer is really more relevant to me than I realized. The other major thing to consider is the financial commitment to breeding. And I work with a certain demographic of people who, I just got this mare and the guy down the street has a stallion. I got a uterus. Wham, bam, I got a free foal out of the thing. And it's rarely that simple. So a lot of practices will have breeding packages. So say everything went absolutely perfectly. We check her on the first cycle. She's ready to go. Perfect. You're still looking at about $800 or so for breeding her on one cycle with fresh cooled semen. If you're using frozen semen, it can be around $1,400 to $1,500 for one cycle. You may do all of that, and then your mare has problems. So she develops fluid post-breeding and has endometritis, and that's an additional expense of flushing her antibiotics if she develops an infection. So there's a lot of added costs that people don't think about. Then you also have the expense of your stud fees, and then costs of missed cycles. So we could get her all the way ready to go, ready to breed, and then the semen doesn't show up. It's lost by FedEx in another state, and you've lost all of that money you've already invested getting her there. Obviously, the cost of foaling complications. If you have a dystocia, you're going to have a big vet bill associated with it. And the cost of a sick foal. So you could get all the way there and then your foal is sick. Have you budgeted for that? So you really need to think about these things before you just say, got a uterus, got a stallion, easy peasy. Because it's usually not that easy. Those are the people that just, they don't deserve it to be that easy. So as far as mare selection goes, younger is better generally. You want a mare, somewhere between 4 and 13 years would be an ideal age for breeding. You want her old enough that she's physically mature enough to carry a foal and that she is cycling normally. Once you get over that 15-year range, they are more predisposed to developing Cushing's disease, and that will reduce your fertility. So you want to, if you have a mare that you're planning to breed that's over 15, we really strongly recommend that you test her for Cushing's. If you're doing it during the breeding season, we recommend a TRH stim test. So that will get your kind of early cases of Cushing's disease. Because I have done that early in my career where I went through all the trials of tribulations of trying to get this mare bred and it wasn't working. I'm like, maybe we should test her for Cushing's like later after we'd spent a lot of money. And sure enough, that was the case. So lesson learned, test them before, get it under control before. And fertility does decrease with age. So older mares tend to have a tighter cervix. And so they're more prone to developing post-breeding metritis. It's harder for them to clear fluid post-breeding. So for those older mares, if you have a maiden 5-year-old and a maiden 20-year-old, they do not have the same conception rate. And I think people don't realize that. So that's just something to consider if you're looking to get a mare for breeding, start early. Is she genetically favorable? You obviously want a mare, you love her, she may or may not have any talent. I don't care about talent, but does she have good body conformation? Are her legs straight? Does she have clubbed feet? This happened like last week. I had a owner that had a new mare and she said, my friend down the road has a stallion. I think I'm going to breed her. She had a horrible club foot. She had a horrible underbite. And I said, is this really like the genetics that you want to be putting into the equine population? Just because you can doesn't mean that you should. If you have a severe case of kissing spine in your mare, that is heritable. So you don't want to pass those genes on to the next generation. And then her attitude does matter. So if you have a lot of people have a nasty mare and they want to breed her to soften her, that may backfire and you may now have a nasty mare and a nasty foal. So don't let that be your main reason. General health considerations, this is very obvious, but worth mentioning. You want a mare in good general health, an ideal body condition score. A lot of these overweight mares, really fat mares, have lower conception rates. If they're too thin, they're more prone to not cycling at all or having early embryonic death. Good nutrition, and one of our sponsors here, Platinum Performance, has a really good general equine supplement that's very good for developing foals and having a good healthy foal in utero. So you can chat with them about that. You want them to be obviously up to date on their vaccines, good hooves, good teeth, up to date with their deworming, and serviceably sound. They don't have to be sound, but we don't want to breed broken mares. And just remember, these brood mares, they give us a lot, so they deserve to have regular trims. They deserve to have good dental care. Just because you're renting their uterus, don't forget about the rest of their body. General, again, take home message, don't breed a broken mare. I think a lot of people have this, she's got laminitis, can't get much more out of her, let's have a foal. And I mean, that's so inhumane. Of course, we wouldn't ask a mare to do that. A lot of these guys that have degenerative suspensory ligament disease, the hormones of pregnancy, once they're bred, those suspensories will drop even more. So have that in your mind. That's not a good breeding candidate. Mares with chronic lameness, they're already dealing with a lot on their body. Is it fair to put them through on their bodies? You don't obviously want to breed a mare that's in poor body condition because of underlying disease. You need to get her healthy first. And again, make sure that any metabolic disease is already dealt with before you start the process. So timing is everything. This is not meant to be an insensitive photo. I hope there are no FedEx drivers in the room. It's just an illustration of, in a perfect world, everything goes great. So in a perfect world, we get your mare cycling early in the year. It allows us to follow her first cycle, when we first meet her, gives us better predictability of how her reproductive tract is going to behave. It allows us time to treat any issues that we might find along the way. If she has an underlying infection or she's prone to developing endometritis. In a perfect world, the semen arrives right as expected, which we often, as you can tell, is not always the case. And then when it arrives, it's alive. So there's a lot of things in the perfect world, but we know that they're not all that easy. So time wise, you want to start early. Timing is everything. Get your mare under lights early. And you know, a lot of people say, I don't want to foal before May. It's too cold. I'm not starting until later. I'm not even going to think about it until later. Please think about it now. You want to give yourself about a year and then about a half a month or a month before the time you want your foal born. So because they are not all bred perfectly on the first day we see them, we need a little wiggle room. So it allows us to check them, follow the cycle, get them bred, and then a little bit of wiggle room. So planning wise, do start now as far as getting them under lights if you haven't already. And as far as lights go, you know, for the thoroughbred people, if there are any here, you know, the breeding date is, you know, Valentine's Day, right? The holiday of love. And so I use the major holidays and start putting them under lights around Thanksgiving time. And that will allow them to be ready, you know, theoretically well cycling by February. You want to add lights until 11 p.m. In these winter months to provide about 16 hours of continuous light per day. You can use a 200-watt incandescent bulb or two 40-watt fluorescent bulbs. And then this photo is, again, one of our sponsors, Equilume, and it's a really nifty mask. I found out it was developed at my alma mater in University College Dublin in Ireland. And I guess they know about having no light there. I would like one just for my mental health. And so it shines blue light into one of the eyes. It's a mask, and it gives the horse that continuous light period. And some benefits of it, obviously the horses don't have to come in at night, so they can stay out 24 hours a day, which a lot of horses are happier staying out. And, you know, it affects their melatonin, so it does get them cycling. Some of their studies have shown that the horses, their gestation periods for these mares that tend to go long, it's shortened a bit, and that the birth weights of their foals are a little bit bigger. So there are some other benefits. And then obviously in sport horses, it keeps their coat short for the winter months, which is nice too, if you're dealing with that. Again, not a big thing about the exam other than to say there will be one. You know, in an ideal world, you want a horse that hasn't been a big problem. You know, if you bought this horse for cheap and it's, you know, they couldn't get it bred for 17 years. Don't take that challenge if you have a choice. You know, try to get one that doesn't have pre-existing problems, of course. Good perineal conformation. So these mares, you know, we always think about if their vulva is tipped or, you know, if it's tipped, they're gonna, you know, feces can go in and they can contaminate themselves. But remember too, the whole internal tract is pulled forward as well. So these guys have a lot more difficult time clearing fluid and cleaning themselves out as well. So that has somewhat to do with good body condition. If they're underweight, everything's going to be tipped, but also these older mares that have had a bunch of foals, they're going to tip as well. So try to start with good conformation. We're going to look at, you know, a good vaginal exam, check out their cervix, make sure there's not urine pooling. We're going to obviously palpate them, ultrasound them, look at their uterus ovaries, that they're cycling normally. We're going to identify intrauterine cysts early in case they're, you know, very large and we need to intervene. And then obviously look for free fluid, signs of infection. And then, you know, case by case, I would say, I assume most of us would do uterine cultures and cytologies on everybody pre-breeding. Some mares require a biopsy, not everybody. And then obviously we can scope the uterus as well if that's deemed necessary. So just a little diagnostic stuff. The other thing that you need to be aware of, and as Dr. Gosselin said, we're not going to pick your stallion for you. That's not our job. But we need to at least know, what type of semen you're going to use for your mare. So is it live cover? What days is the stallion in the shed? That's important to know. Obviously, if you're using fresh cooled semen, what days do they collect? What time zone are they in? And you always run the risk of delays in shipping with fresh cooled semen. If you're using frozen semen, how many doses do you have? How many straws are in a dose? It really depends on the concentration and the volume of the semen in each straw, and they're variable. So this is information you need to know ahead of time. If you have one dose, it's a much bigger challenge for us to get the mare bred, especially if the stallion is dead and that's all you have. So this is just information that we need to know in preparation. And then finally, on my side, again, before you get all of this emotional, financial investment, where will your mare foal out? Where will the foal live? You can have these foals run around, you have nowhere to put them. Will there be other horses that it's going to grow up with? Do you like young animals? They're kind of jerks sometimes. And will you train it? So we don't want a bunch of ill-behaved homebreds. So I'm going to kick it over to Dr. Gosselin, and she's going to continue on. Thanks.
Okay, so now we're going to talk about the foaling part. And I have to apologize right now because I brought my soapbox with me, and I'm probably going to throw it down a couple of times and climb up. So just be aware. But we're in addition to watching me climb up and down off the soapbox, we're going to talk about pre-foaling vaccines and testing for NI. We're going to talk about monitoring your mare for foaling, how to set up your foaling kit, what your emergency plan is, and the importance of an emergency plan, the benefit of colostrum testing and collection, and neonatal exams and IgGs. So I think that it's really important to understand that pre-foaling vaccines are essential, right? We know that the mare creates colostrum, and the colostrum is antibody rich, and it's important to put the right vaccines into the mare before she foals so that the foal, after it consumes the colostrum, gets high level of antibodies to the diseases that it's going to be exposed to. But I will tell you that not all mares are going to get the exact same pre-foaling schedule, pre-foaling vaccine schedule. Partially, it's due to where the mare is going to foal, where the mare and foal are going to travel. And then also, I think some of it is up to the veterinarian, the discretion of the veterinarian. So I will tell you, like, AEP creates a list of core vaccines that you can look at, and those are the vaccines that absolutely they recommend for every single horse. In terms of pre-foaling vaccines, I would actually say if I was to create a core list of pre-foaling vaccines, I would list EHV1 or Rhino, and the trade names for those are a Prodigy or Pneumabort, as a essential pre-foaling vaccine. Those are going to be given at 5, 7, and 9 months of gestation, and it helps to protect against virus abortion in the mare. So every pregnant mare should get EHV1 or Rhino vaccine at 5, 7, and 9 months of gestation. If the mare is going to foal at a farm where there are multiple foals being born, then I'm going to recommend that the mare gets vaccinated for rotavirus at 8, 9, and 10 months of gestation. Rotavirus helps to protect the foal for situations of rotavirus-caused diarrhea. So if the mare is going to foal by herself and she's going to be maybe one of two, and there's not a lot of foals that are born at this place, I would say rotavirus is not necessarily essential. But if there's a lot of risk and you want to cover your mare for everything and your foal for everything, then I'm going to recommend that we vaccinate the mare for rotavirus at 8, 9, and 10 months. Botulism. Botulism is something, again, that we vaccinate the mare for protection of the foal. So if we are going to ship our mare and foal to be bred in places where botulism is an issue, like Kentucky, then we would vaccinate our pregnant mare either annually once the mare has had an initial series, which happens at 8, 9, and 10 months of gestation, or we were going to get her on that annual cycle, so she would get that initial series. Some veterinarians like to vaccinate against leptospira, which is another form of abortion, can cause abortion. And those mares are vaccinated in the fall. And then if we are going back again to the pregnant mare core vaccines, I think every veterinarian is going to recommend Eastern, Western, and tetanus in that period of time from like 4 to 8 weeks prior to foaling. And that helps to really boost those antibodies before the mare foals so that the colostrum is rich and will provide that protection to the foal. You will have some variability in terms of what veterinarians or farm managers are going to recommend in terms of whether they do include rabies in that last pre-foaling set of vaccines, or flu rhino, West Nile, and Potomac. And there's a lot of variability in terms of when people recommend strangles and if they include those in their pre-foaling package. Another thing to consider before the mare foals is testing for NI. NI is neonatal isoerythrolysis. I knew I was going to stumble over that word. And it's basically a situation where the mare develops antibodies that she produces in her colostrum that attack the foal's antigens on its red blood cells. So the foal consumes the colostrum. It then attacks the antibodies on the red blood cells. The red blood cells lyse, and the foal develops anemia. The antibodies are basically the symptoms of NI can be pretty nonspecific, but you can see them anytime from, I read somewhere, as early as 9 hours to up to 3 days later. We had a mare that foaled a couple of years ago, and when I got there for the pre-foaling or for the new foal exam, the foal was already like just totally out and was severely affected. So don't discount that as something that doesn't happen at that 8-10 hour check. Like, it is altogether possible. The symptoms can be, like I said, nonspecific. The foal can stop nursing, can just be completely out, flat. Can also, in this picture, you can see that the foal is icteric, where it has yellow mucous membranes. And you'll see that like on the gums and the eyes, and sometimes like the lips of the vulva and fillies. So it's something to be aware of. The good news is we can screen for this. And so we can do screening for foals, or we screen the mares approximately 2 weeks before their due date. And we look for, blood type them and look for the presence of, the potential presence of these antibodies. And then basically once the mare foals, then we can do a jaundice foal agglutination test. If the mare screens positive, you test the foal as soon as it is born, before it starts nursing is the idea. And then you do this JFA test where you introduce some of the colostrum with the foal's blood, and you look for clotting. So that's how that works out. Monitoring your mare. So this is where I'm going to get up on the soapbox and talk about, are you prepared to monitor your mare? I know that some people are like, oh yeah, I'm going to have a foal. I'm really excited about it. I want to see the miracle of birth, right? But there's a lot involved in the miracle of birth. First, I'm going to say that it's really important to like confirm the due date of the mare. Like, sometimes you get information passed along, and then you later on learn that the due date wasn't actually correct. So check the last breeding date and do the math yourself, and make sure that you're confident in terms of when that due date period is. And you also need to know to look for physical changes, and you need to know what those physical changes are going to be in the mare, right? So if you get to your due date for your mare and you're like, oh, maybe I need to figure out how things are going to change, it's a little bit too late by that point. Like, do some research leading up so that you're aware of what the physical changes are going to be, so that if your mare starts bagging up prematurely and developing an udder prematurely, you're aware of that and you see it happening, and you know, hey, that's not right, or that's appropriate for her, considering the due date. Also, look at pH testing. If you're foaling one mare or 2 mares, there's a lot of value in pH testing. And I talked about this last year at our symposium, and I think there's probably a recording maybe of that up on cavalcadeeducation.com. But there's a lot of value to pH testing. Some people, I think, find it frustrating. But what you're looking for is you're getting a sample of the mammary secretions and you're looking for the pH to drop. And it'll drop from above 7 to usually it's like 6.4, approximately 12 hours. There is some 12 hours before foaling. There's some variability there, and especially with maidens, and you have to test more than once a day. But there are people that have used this and it's been very successful. There's also commercially available predictable kits. Again, you have to get comfortable using them and you have to test regularly so that you can see the trends. That's really what you're looking for, is trends. And then at the end of the day, someone should be there when the mare foals, right? You should have a night watch person. Or if there's not going to be a physical presence in the barn, there should be cameras that are on the mare. And then I'm always going to recommend an alarm system. This particular alarm system in the upper right corner is full alert, where you suture this. It's basically a key into the vulva. And when the mare breaks her water and the fetal membranes push through, then it pulls the pin out of the key. So there are other options, like there are monitors that are on halters and all sorts of things. But I think the more systems that you have in place, the more likely you are to catch it when the mare foals and to not have her foaling without somebody monitoring. So setting up your foaling kit. The list that I have here is mostly things that were provided by the AEP, and then I plugged in a couple of things that I felt were useful. A bucket, a tail wrap. The tail wrap can be either like something that you can wash over and over, or it can be like disposable brown gauze or vet wrap. Cotton, disposable gloves or sterile sleeves, depending on how involved you're going to be in the process. Sharp scissors, navel dip, and that can be either diluted betadine or diluted nalvasan or chlorhexidine, and a cup. And the cup, it's important to recognize that this is a dip, it's not a spray. Like, I'm not a big advocate of spraying a belly button, because I don't think it does as good of a job. Whereas I think if you're dipping the belly button, you're actually getting the tissues well coated in the dip. So we use either a shot glass, because I know you have shot glasses from all the places you've traveled to, and you're like, what do I do with this shot glass? It's an excellent option. Also, you can like cut the tip off the end of a 35cc syringe and invert it, and use that as a dip cup, where you just put the solution in it, you squirt it up onto their belly wall when you have the umbilical stump surrounded, and wiggle it around, and that does a really good job. I'm sure everybody has lots of ideas, but the important thing here is not a spray, a dip. Full enemas. I like fleet enemas. Again, I'm gonna say you can give 2 enemas. Beyond 2, do not. Like, tell your veterinarian, have a conversation. And I actually really like to don't throw away your enema bottle after you use it. You put a little bit of warm soapy water in there and you can reuse that over and over. But it's really helpful so that you can reuse that enema bottle on the foal that you give the initial enema to. Umbilical clamps or tape, clean towels, a thermometer. And then again, a colostrum refractometer. I think a colostrum refractometer is an essential part in everybody's foaling kit. And I have a measuring cup in here. I know that some people can probably express a little bit of colostrum out onto the refractometer. I'm going to say put it in a cup and then put it, and make sure it's a dry cup, that it doesn't have any other stuff in it. But use that and then transfer it into your refractometer so that you're not like in there and then it gets kicked and it flies across the room and then it's a broken refractometer. Headlamp, flashlight, and then I included for optional, depending on how comfortable you are and how versed you are in foaling, a pulling strap or a pulling or chains with handles, a full resuscitator. And I think maybe sometimes it's like, if you buy this and put it in your kit, maybe you don't have to use it. And then I included baling twine, as I think it's really important when you tie up the fetal membranes to have some sort of string structure that you can use to tie up the fetal membrane. So I like baling twine because most of us have it. And then Banamine paste or injectable Banamine. Is there anybody here that's like, you're missing this? Because we could all benefit from that. If you have like absolutely, I have to have this in there. Nobody? Ah, okay, brilliant. So, and that actually transitions very nicely, I think, into my next slide. But yes, they included on the AAP, they included paper and a pen as one of the things. And I think I've gotten to this place where I try not to use very much papers and pens these days because I feel like I leave stuff behind me. But your phone will work for that. So you can write down, she broke water, you write it into your phone. You know, the foal was born at this time. Then you can look back and say, oh, or a stopwatch. Some people use a stopwatch. And then absolutely, if your veterinarian's phone number is not in your phone, then you should have it like taped to the side of your foaling kit. So I totally agree with you. And this foaling kit is actually available commercially. You can purchase this handy dandy kit. I do think there's maybe a little too much in there, but it is available, I think, from ARS, and I think the price is around $250. And they have it's like a base level, and then they have like the Cadillac level, and the Cadillac's like twice as much. So that is a possibility. So emergency plan. There are a couple of reasons why you should consider and be prepared for an emergency. One is dystocia, like Dr. Jaynes was talking about. Either you notice that there's an abnormal presentation when the foal is initially presented. If you palpate and there are 2 feet and a nose, then you're probably good. But if you feel 4 feet, or if you don't feel any head, any of those things obviously are indications that the presentation is abnormal. So that can be a situation where you're in a dystocia situation. And when the stages of labor, specifically stage 2, is prolonged. So stage 2 is defined by the period of time from when the mare breaks her water to when the foal is expelled. And so if that takes longer than 30 minutes, it's too late. So if you're in that situation and the mare is not progressing, I'm a bit of a wuss. I usually like 15 minutes. And if we're not seeing stuff, the mare needs to be up and walking, and I want the trailer ready to go. So have a plan for that. And that's where the stopwatch comes in handy. That's where taking notes on when the water is, when she breaks her water. And then if the mare has the foal and all of that goes well, then you start to think about your 1, 2, 3 post-foaling rules. And I don't know if everybody's familiar with this. It's pretty easy. Within the first hour, the foal should be standing. Within the second, it should absolutely have a suck reflex. And I would actually say it should have a suck reflex within the first hour. I feel like most foals have a suck reflex before they're standing, but it's important that it's not as neat, and it doesn't make their 1, 2, 3 work unless they put suck reflex somewhere in the middle. And then within 3 hours, the placenta should be passed and the foal should be nursing colostrum. So if you have an emergency, you should know, who are you going to call? Does your veterinarian deal with dystocias? How far, if you've been watching your mare and it's 20 minutes after she's broken her water, and your veterinarian is 45 minutes away, it now becomes a race against the clock, right? So you need to have a plan in mind so that you can maximize the chances of both the mare and the foal's survival. And that means if this mare and foal if you're considering referral as an option so that the mare can be dealt with at a referral hospital, you need to know, you need to load and you need to call your veterinarian and say, this is my game plan. And these conversations should be had before you're in the emergency. If you have a pregnant mare, talk to your veterinarian and say, this is what I'm planning on doing. I will call you I will tell you, I'm loading and going. I will tell you what the presentation is. Please call the referring hospital or the referral hospital. And that's a plan. So who are you going to call? Where are you going? Like, clearly you should go someplace where they can deal with the situation, but you should have that in mind. Whoever's driving should know, oh, I'm going to Rhinebeck. They should be prepared that that's where they're going to go, and they should know how to get there. And then also, like, how are you going to get there is more about how the directions that you're going to take. It's more about, do you have a truck and trailer? Is it ready to go? And we've had places where, I mean, they want to do their very best by the mare in full, but if you spend 40 minutes calling a van service, time is ticking. So be prepared for that. All right, going back to my colostrum soapbox. So everybody should have a refractometer. And the reason why I recommend it is twofold. One, you need to know if the foal that was just born is if the colostrum that foal is going to get from the mare is good enough, or if you need to provide it with donor. And then the next question that I'm going to have you really focus on, because it's really important in my heart, is that I need you to think, can I collect and bank this mare's colostrum? So one farm that I know, they collect like 8 to 12 ounces of colostrum. They give the foal while it's down a bottle of the colostrum, and then they take the rest of it and they put it in the freezer. So it's a really easy process, and I highly recommend it, because then when you're in a situation where your next foal, the mare has like poor or fair colostrum, it's not going to get it done for that particular foal, and you can reach for your bank and you can provide it in a bottle at that time, or your veterinarian can tube the foal later on. There are different ways to collect the colostrum. You can either use an easy milker, where it's basically this gun system and it just puts it directly into your bottle. You can use an inverted syringe if you struggle with the easy milker, where you cut off the tip and you invert the syringe, use a 60 cc syringe and use that and just dump it into your bottle. And you can just use a measuring cup. If you're like gifted in the art of milking mares, a measuring cup will get it done. So I will say, like, I'm a fan of all of the Brix refractometers. Some of them, like this one that you can get from ARS, comes with gradations that shows it's very good, fair, and poor. I would actually say that I think I would say good is probably like closer to 25. I'm a little bit of a colostrum snob. So I just feel like you just have to put a lot more colostrum into the mare or into the foal in order to get the IgG to pass. So I usually say if you're like at 22 or above, you're probably going to be good, as long as that foal drank enough. Below that, if you have donor, I would consider it. So anyway, donate to our colostrum banks. Rhinebeck and Millbrook have a combined colostrum bank. And we are taking donations for colostrum that you gathered from the year before, or anything that you want to give us. It really helps. And then it's not something that we basically made a donation to the Foundation for the Horse for all of the colostrum that we sold to clients last year. So it's not something that we're trying to make money on. It's really something that we need for the benefit of the horse community. Okay. Yeah, Dr. Javsikas just said that Rhinebeck has bottles where if you need to go by and pick some up for this year. Also clean soda or water bottles will work in a pinch. And then we have gotten to a place also where we just buy those easy milker bottles. And so that way, if someone wants to use that and they give us a bottle full of colostrum, we're just in that moment give them a new bottle back. So the more that people the more participation that we have in actually collecting colostrum, the more this will succeed, because we don't have a lot of mares ourselves to make it work. So it really is community dependent. That's a really good question. The question that she asked is, how long does it stay good for in the freezer? And what I would say is my preference is for this season to use colostrum that we gathered last year at the early part of the season. Clearly, if you have colostrum that's like 2 and 3 years old, it's not as good. But people will, if you have a situation where a mare foals and then there's a dystocia and the mare doesn't make it, or there's any other post-foaling complications, we can still use that colostrum in place of milk sometimes. So I would say whatever you do, never throw it away. Like bring it to either Rhinebeck or to Millbrook and say, hey, I've got this. Do with it what you will, because I think that sometimes we're in a situation where we don't have a lot of options, and we will use colostrum if we have it that's like 2 years old. Is it our preference? No, but we will. So I think if you have it, please don't throw it away. And then really quickly, I think everybody understands the value of a neonatal exam and IgG testing, but I want to point out, like, there are few exams on the horse where you get as many body systems evaluated as we do in a neonatal exam. Like, we're looking, obviously doing a TPR, listening for a murmur. We're looking at the eyes, doing an oral exam of the bite, palpating the thorax for fractured ribs, palpating the umbilicus, palpating for hernias. We're looking for angular limb deformities, and we're examining fetal membranes. And so I would say, like, you get a lot of bang for your buck when you let one of the veterinarians examine your foal. And for example, like something like fractured ribs, it's really going to change how you manage that foal going forward. So if you don't know about it, and you turn that foal out, then potentially the fractured rib can do some damage. So we're always going to advocate for doing neonatal exams. And then there's variability between veterinarians in terms of what type of blood work they do in their standard blood work on neonates. But we're doing more and more CBC fibrinogens. Some practices do SAAs, and then obviously an IgG. And we have really moved away from qualitative IgGs where, you do like the gamma check, or I would argue that the SNAP test is, in fact, it's a qualitative test. We're trying to focus more on getting an absolute number and doing a better job at identifying those foals that actually aren't passing. Because I have to say, I think for a long time, foals we think they've been passing and they haven't. And so when we think about what the ramifications of that can be, like joint ill and some of those things, it's really essential that these foals are starting off on the right foot. So, any questions? Yeah, no, I think I agree. So Annette wanted to add, we're going to make our rule 1, 2, 3, 4. And we're going to say like 4 hours should be passing the meconium. I totally agree with you, Annette. I think that that's a huge part of making sure that the foal's going to be comfortable, and having somebody looking out for passing the meconium is a big deal. What are my thoughts on adding oxytocin to your foaling kit? So I personally think that mares post-foaling are exceptionally sensitive to oxytocin. I think that if you're going to treat a mare with oxytocin, I think that she has to have retained her placenta for a good amount of time. I'm not an advocate for giving oxytocin to a mare that is on a normal schedule. She has plenty of endogenous oxytocin that I don't need to add it. In fact, I would be concerned about things like uterine prolapse. Sometimes mares can get exceptionally painful and crampy. And so I'm going to say no to that unless the veterinarian says, yes, the mare has retained for a period of time, go ahead and let's try this. But I would advocate, do not do any of those things without your veterinarian's advice.